India is marking 3 years since its last reported polio case, a landmark in the global battle against the disease. It is seen as confirmation of one of India's biggest public health successes, achieved through a massive and sustained immunization program. India's health minister hailed it as a monumental milestone. In 2012, the World Health Organization removed India from the list of polio-endemic countries. Pakistan, Afghanistan and Nigeria remain on it. The list refers to countries in which the virus is circulating freely and the transmission of the infectious disease has not been stopped. Despite India's success, health experts fear a resurgence of polio in other parts of the world. Last case. This monumental milestone was possible due to an unwavering political will at the highest level, commitment of adequate financial resources, technological innovation, and the tireless efforts of millions of workers, including more than 23 lakh, 2.3 million, vaccinators. Health Minister Ghulam Nabi Azad told reporters, the WHO is expected to formally certify India's polio-free status next month after testing its last samples. India has now set other important public health goals as a result of the confidence that the country has got from the successful eradication of polio. Nicole Deutsch, head of polio operations for the UN children's charity UNICEF in India, told the AFP news agency, citing a new measles eradication goal. Only one case of polio was recorded in 2011, down from 741 in 2009. It came from the eastern state of West Bengal in 2011 when an 18-month-old girl was found to have contracted the disease. Raksha Khatun is now going to school and leads a normal life, although she still suffers pain in her right leg, her doctors and parents told AFP. She can now stand on her feet and walk, but can't run. When her friends play, she remains a spectator, her father Abdul Shah said. Mr. Shah said it had been a grave mistake only to get his son vaccinated for polio, but not his 2 daughters. After the eradication of smallpox in 1980, polio is the second disease in India that has been eliminated through immunization. Nearly 2.3 million volunteers visit 209 million homes to vaccinate some 170 million children under 5 years of age in India. During every round of immunization, polio is capable of causing crippling disability or death within hours. It plagued societies in ancient times, and was present in more than 100 countries even in the 1980s, when it left 350,000 people paralyzed each year. Despite a quarter-century-long vaccination program, experts fear it could make a comeback in countries riven by conflict. Outbreaks in Syria and Somalia, where vaccination programs have been disrupted, could hamper efforts to rid the world of the disease. Polio immunization efforts have been suspended in parts of Pakistan and Afghanistan because of attacks by militants who see the campaign as a Western plot. BBC correspondents say unless immunization is restarted promptly, polio could infect more children, with a risk it could spread beyond Pakistan's borders to India.